Hello everyone. In this video, I'll be going to explain about glomerulonephritis. So before going into the concept, let us know about the basic anatomy of the kidney. As we all know that the nephron is the structural unit of the kidney and contains glomerulus, tubule, and the common collecting system. And the glomerulus is the basic filtering unit of the kidney and contains the anastomosing network of capillaries which are formed from the afferent arteriole. And the capillaries inside the glomerulus contains the fenestrated or window-like openings, which is also called as endothelium, which lines on the glomerular basement membrane. So these cells inside the basement membrane are called as the endothelial cells. And the outer portion of these endothelial cells are in contact with the inner surface of the basement membrane, and the central part is in contact with the mesangial cell and the mesangial matrix. And the entire outer part of the glomerular basement membrane is in contact with the food processes, which is also called as visceral epithelial cell. And the visceral epithelial cells line the glomerular side of the Bowman's space, whereas the parietal epithelial cells line the Bowman's capsule on the opposite side. Okay, so on the same side it is lined by the visceral epithelial cells, but on the opposite side it is lined by the parietal epithelial cell. This is nothing but the parietal epithelial cell. And the mesangium contains of mesangial cells and the basement membrane like mesangial matrix and supports the entire glomerular tuft. And coming to the glomerulonephritis, it is nothing but it's a condition of the kidney which causes inflammation and the damage to the glomeruli. And there are two types, that is primary and secondary. Primary involves only kidney, whereas a secondary involves, it is secondary to the systemic disease. And next, coming to the histological alterations. So whenever there is glomerulonephritis, there are three main histological alterations. One is increase in the cellularity, thickness of the basement membrane, and hyalinization or sclerosis. So coming to the increase in the cellularity, it is characterized by an increase in the number of cells in the glomerular tufts. Such lesion is called as proliferative glomerulonephritis. And this hypercellularity may be due to the cell proliferation. That is, it may involve any of the cells in the glomeruli to proliferate, and the leukocytic infiltration. They include neutrophils, monocytes, and lymphocytes. And formation of the crescent, which is mainly due to the fibrin which leaks into the urinary space, and also because of the proliferation of the parietal epithelial cells and the infiltration of the leukocytes. And coming to the thickening of the basement membrane, this thickening of the basement membrane is due to the deposition of the electron-dense bodies. And these are nothing but the immune complexes which are in the endothelial or the epithelial surface, or they may also lie in the glomerular basement membrane, such like in diabetic glomerulonephritis. Coming to the hyalinization or sclerosis, hyalinosis is nothing but the accumulation of homogeneous eosinophilic material and it especially contains the plasma proteins which have been leaked from the circulation due to the endothelial injury. And sclerosis is nothing but the accumulation of extracellular collagenous material either in the mesangium or in the capillary lobes. And next, coming to the pathogenesis. And the pathogenesis is mainly of two types. One is immune mediated and the other is non-immune mediated. And in the immune mediated, again there are three types, that is antibody mediated, cell mediated, and complement mediated. And the antibody mediated contains again of two types, that is in situ and circulating immune complex. The antibody mediated, here in this antibody mediated process, there is mainly deposition of immune complexes. It may be antigen antibody complex. So why do you think there is deposition of the antigen antibody complexes? It is mainly because of two properties. One is the charge of the molecule and the other is size of the molecule. So what do you think about the charge of the molecule? If a molecule is highly anionic molecule, it cannot pass through the glomerular basement membrane because the glomerular basement membrane is already negatively charged, and if highly anionic molecules go into this try to go into the basement membrane, they can't cross because like charges repel, and such deposit will be called as the subendothelial deposit, which happens between the glomerular basement membrane and the endothelium. Okay, so that is in this region. And if the molecule is cationic, that is highly positively charged, it can cross the glomerular basement membrane because the negatively charged membrane attracts the positively charged molecules, and so that they will get deposited in between the basement membrane and the podocyte. And if a molecule is neutral charged, then they cannot pass anywhere, neither subendothelial deposit, neither subepithelial deposit. So they'll just deposit in the mesangium. And coming to the size of the molecule, the medium sized molecule is more pathogenic compared to small size and large size. Okay, so if a particle or if an antigen belongs to in situ, it may be of two types again. It may be fixed antigen or planted antigens. Fixed antigens means it's anti-glomerular basement membrane nephritis, that is, they're already fixed inside the basement membrane. But whereas the planted antigens, they can be exogenous or endogenous, that is, they get planted later. But fixed antigens are already fixed in the glomerular basement membrane. So if it is an exogenous one, it may be of infectious agent or it may be of any drugs. If it is an endogenous antigen, it can be again of two types, that is DNA and nucleoproteins. If it is a circulating immune complex, again it is of endogenous antigens and exogenous antigens. As I already told, inside, that is endogenous, contains of DNA, or it may be tumor antigens which are produced within the body. So exogenous antigens are infectious products. And the main important syndrome here to remember is about the good pasture syndrome. It is an autoimmune disorder. So it happens because of the changes in the alpha 3 chain of the type 3 collagen in the glomerular basement membrane. So when there is a change in the basement membrane, the antibodies which are formed against the renal glomerular basement membrane, they cross react with the basement membrane of the lung alveoli, so that we can see hemorrhage, hemoptysis. So what can we see? We can see hemorrhages or hemoptysis. Okay, hemoptysis. So these are the conditions which are caused due to the good pasture syndrome. And next, coming to the cell mediated and the complement mediated one. So it happens because of the cell mediated immunity, which gets activated due to the deposition of these antigens. And complement mediated is because of the deposition of the C3 in the glomeruli. So let's just easily understand about this thing in this diagrammatic representation. It's mainly of antibody mediated ones. So if it is an in situ one, or if it is a circulating immune complex, what happens? Fixed antigen, as I already told, they are already fixed to the basement membrane, right? So when they come in contact with these antibodies in the circulation, they form antigen antibody complex and they lead to glomerulonephritis. In the same way, planted antigens, which gets planted later in the life, okay? So when these gets planted, in the same way, the antigen antibody complexes are formed, and so that they leads to glomerulonephritis. In the same way, circulating immune complex, when there is exposure to antigen, okay, the antigens in the circulation, when it comes in contact with the antibody in the same circulation, same way there is complex formation and again leads to glomerulonephritis. So how do you think these immune complexes looks under an electron microscope? They looks as an electron dense deposits, whereas in the immune fluorescence microscopy they appear granular in appearance, okay? And coming to the non-immune mediated, which may be genetic, metabolic or ischemic or toxic reasons. So genetic reasons like Alport syndrome, which is a hereditary collagen mutation, and if it is a metabolic thing. It may be of diabetes or hyperlipidemia or amyloidosis or gout. And ischemia includes like actually some toxic agents. Ischemia is maybe due to the deposition of some things inside the capillaries, which leads to the improper supply of blood to the glomerulus. It may be one of the reasons. It may be due to injury or any kind of depositions like stones and all. If it is a toxic reason, it may be because of the NSAID, that is non-steroidal anti-inflammatory drugs, and chemotherapeutic agents. When a cancer patient acquires chemotherapy, then she or he is more prone to the this kind of glomerulonephritis. And heavy metal pesticides, especially who is working in the factories like that. So, and renal artery stenosis, which leads to ischemia, right? And next, let us just summarize about this pathogenesis. As I already told about the immune and the non-immune mediated reasons, what does it leads to? They make the membrane porous, due to which the inflammatory infiltrates, they reduce the movement across the membrane so that the filtration rate decreases. If the filtration rate decreases, then the salt will not get excreted outside the body, so that there is salt retention. Okay, so that what happens, there is expansion of the intravascular fluid, which leads to hypertension and pitting edema. And the other consequence is that when the filtration rate decreases, there is oliguria, that is excreting the urine less than 400 milliliter per day. But normally a normal person should excrete about 1.5 to 2 liter per day, but in the oliguria, less than 400 milliliter per day of urine is excreted. And insufficient filtration and excretion of urea occurs, which leads to the accumulation of urea inside the body, which is called as azotemia. Okay. So, what is the fate of these immune complex deposits? If it is exposure to a short time, okay, it may lead to some nephritis like post-streptococcal glomerulonephritis. Here, the inflammatory cells, mesangial cells, and the endogenous proteases, they degrade the complexes and leads to the inflammatory reaction. But when the exposure is for a long time, then diseases like systemic lupus erythematosus and viral hepatitis may cause more and more injury to the glomeruli, and they may lead to the chronic membranous or membranoproliferative glomerular nephritis. So, this is all about the pathogenesis and about the histological alterations about the glomerulonephritis. Thank you. Like and subscribe.